All right, we're going to get started. Thank you all for coming out. It's an extremely gratifying experience to have people from the community turn out for this important issue, especially given the variety of events and actions that are going on in the election season. This is an important one. We're going to be discussing healthcare as a human right, why it doesn't exist, and how we can get to a more just world. So without further ado, I'm going to turn it over to our very capable and wonderful co-chair of Lighty ESA, Lily Oster.
So thanks so much for being here. I know a lot of you probably work in healthcare or have some personal experiences in our healthcare system, and here in Miami, in Florida, and in the U.S., we can see both through our everyday work and our personal experiences how broken our healthcare system is and how much work needs to be done to really realize our vision of universal, equitable healthcare and really realize a vision of healthcare truly being a human right. And so we're really honored and privileged to be joined by two of the country's leading experts on not only on the policy angle of Medicare for All, but on how we actually organize for and win Medicare for All. So we have Jose La Luz, who's a veteran labor and civil rights organizer and is serving as the Hispanic outreach coordinator for the Medicare for All campaign. And he has lit a path for all of us to build a broad multiracial movement for universal health care, or Salud para Todos. And we're also joined by Michael Lighty, who's on a countrywide speaking tour on behalf of the Medicare for All campaign of the DSA. So we're really lucky to have him here in Miami. And he's one of the country's leading experts on single-payer health care. He was also a former director of the DSA several years ago, and he was the lead policy analyst for the Healthy California bill, SB 562, or the Healthy California Act. And he has held several positions, most recently at National Nurses United, where he's currently on sabbatical, so not representing NNU today. But we're really privileged to have him here and learn from his experience in coordinating many different campaigns, from patients' bills of rights to the National Robin Hood Tax campaign. So thank you so much for joining us today.
Thank you all. I have the honor and the pleasure to speak here today with Jose La Luz, who is a comrade of many years and an inspirational leader of this movement. And we've just in the last year been really dig in this movement for guaranteed health care and Salud para Todos. And I've learned so much. I want to talk about first my experience with National Nurses United. I worked there for 25 years with registered nurses, and I learned fundamental lessons about the human condition, about the art and profession of caregiving, and about the importance of kindness. Every day at the bedside, registered nurses, whether they're in the bedside or out in the streets demanding Medicare for All, or even on strike for better staffing for patients, they show all of us that they will never give up on their patients or their country. That should be a lesson. Neither should we. We should never give up on the possibility for reform that can fundamentally transform our society through transforming our healthcare system. The nurses' commitment to a single standard of safe therapeutic care enacts a quality at the bedside. The system doesn't do it, but the registered nurses do it. And from their commitment to health justice, we learn to address not only the causes of social disparities that shape our lives, longevity, and health status, but those underlying structural reasons for those gross disparities. So my work with National Nurses United taught me very clearly, without justice there is no health, and without health there is no justice. And on this path to justice, we see the rampant misogyny of the present administration and the right's desire to control women's bodies, though that is the hallmark of their program. And we know that women are more likely to use the healthcare system than men, often caregivers themselves for their families, often professional caregivers. They know that their children, their families depend upon their ability to provide care. And so we see then the barriers to that care in many cases of reproductive health and the care for aging. So health justice must very clearly mean the repeal of the Hyde Amendment, and which bars, as we know, taxpayer dollars from being used for abortion. It must also mean prohibiting discrimination based on any type of sex stereotyping, gender stereotyping, sexual orientation. And we saw just this week the Trump administration's desire to eliminate transgender. It is extraordinary representation of the misogyny and sexism at the heart of this administration. We also see injustice in the many manifestations of structural racism. The arrest, fine, and incarceration, jail time suffered by black men. The ongoing historic exclusion of Asian Pacific Islanders from the workforce, which has had devastating long-term consequences for their life and longevity. These often determine life prospects, and by extension, the quality of health care. We know that Native Americans, Alaska Natives, American Indians are much more, twice as likely as whites to be uninsured. African Americans have a higher uninsured rate. So health justice must mean very clearly no one is affected by inequality in health care. And again, the nurse's lesson, a single standard of safe therapeutic care. When I was in Texas, and I certainly feel it here too, we see the effect of the administration's policy on immigration, separation of families at the border. But it begins before that, as they leave poverty and violence in their home countries. And then they come here, they're denied even minimal contact with their family, minimal food, they have no resources, and they're refugees essentially from violence. They suffer deprivation, sometimes sexual assault. But we need to understand that the psychological toll and the physical health impacts are felt not only by them, but reverberate in society as a whole. And I think Dr. King said it best. He remarked, "We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects us all indirectly." And what a powerful lesson for the treatment of immigrations and for looking at our healthcare system. It's clear that all of these injustices lead to and are reinforced by a basic injustice in healthcare. We know that through guaranteeing healthcare as a human right, we can address these injustices, though not fully rectify them. But it would do a fundamental thing. It would undercut economic insecurity underlying those injustices. Medicare for all, I want to argue, is thus a powerful affirmative response beyond resistance to the misogyny, to the structural racism, to the treatment of immigrants. This is a program that can address those and also unite us in the fight for something that will transform society as a whole. It will greatly improve the material conditions of workers, of women and people of color. And that material improvement will have a fundamental justice impact. I drop my water. Usually I spill my water, so this is an improvement. The other lesson I learned from nurses was to take the patients as a whole, to look at the healthcare system holistically as they do their patients. And when you do that, you realize you've got to privilege public health, because public health is the means to address the social determinants of health, to address the disparities and inequalities and injustices. And that principle of public accountability, public financing, and a holistic approach that's embodied in the public health system should characterize the healthcare system as a whole. So we learn from nurses that not only to address the determinants of health, but those systemic roots of those social ills. What underlies poverty? What underlies homelessness is a political economic economic structure that creates that inequality and injustice. And so through understanding and fighting for Medicare for all, we can get at those structural barriers. So on this path to justice lies a confrontation with power. Because the ruling class in this country has a special distaste for universal health care, even for the possibility of it. Since the post-World War II period, American businesses and the medical establishment have said, okay, workers, you can gain some rights and some material improvements, but not publicly financed, not guaranteed health care, not improved Medicare for all. And really, when you look at it, it's quite remarkable, because the ruling class fight against guaranteed health care. And that's what we talk about. When we talk about Medicare for all, we're talking about guaranteed health care with no barriers to care. Guaranteed health care with no barriers to care is what we call improved Medicare for all. Not surprisingly, it's hugely popular. 70% of Americans in the latest poll support it. Yeah, that's right. 85% of Democrats, 52% of Republicans. We know from 2016 that 52% of Republicans, or not even necessarily Republicans, those who voted for Trump, who made less than $30,000 a year, supported Medicare for all in the exit polls. So we have to, really not surprisingly, then we end up with 16 senators on Senator Sanders' bill in the Senate. Okay, all this popular support. Not a partisan issue. This is not a Democrat or Republican issue, as much as they want to make it that. And then we have these senators on the bill, and they call it crazy. They call it crazy. Okay, you want to talk crazy? United Health. You heard of them? Largest insurance company in the country. $12 billion in profit in 2 years under the Affordable Care Act. $66 million to their CEO, Stephen Helmsley, in 2016. Now that goes a long way in Minnetonka, Minnesota. I got to tell you, that's where they're based. But that's crazy. That is crazy. And frankly, the ACA has been very good to hospitals, insurance companies, and especially the drug companies. But it hasn't been the cost curve. And that was the rationale. Why is your copay gone up? Why is your deductible higher? Why do you have a limited number of providers you can go to? That was all designed to restrict access in order to save money and bend the cost curve. But instead, we just end up subsidizing huge profitability of United Health, of the prescription drug corporations, and even hospital systems. Nonprofit hospitals are nonprofit in name only. They too pursue the bottom line. And they did very well under the ACA, especially before the Trump administration's rollbacks. HCA, a big healthcare hospital corporation in Florida, hugely profitable. And they have new models of care. Oh yeah, we're going to send you over into those things we used to do in the hospital, we're going to do in clinics. Why would they want to do that? We know the safety regulations are yes, but the margins are exponentially higher. They might make 7 cents on the dollar in a procedure like in a cardiac cath lab that's in a hospital. They can make 50 cents or more if they do it in a clinic owned by their doctors. And so that you understand that these hospital systems are part of the same healthcare industry, which is in direct contrast to healthcare as a caring profession. And that's what nurses
like urgent care clinics.
The urgent care clinics, are just an unregulated lesser ER that is not as safe, that doesn't have the same skilled workforce, and in fact doesn't have an OR or hospital attached to it. So you end up in an urgent care clinic with a heart attack, you are in serious trouble, and you are in the wrong place. But that model of urgent care speaks to the fact that we don't have a system that emphasizes primary care and preventive care. So instead we have these fly-by-night clinics, quick clinics. They are designed to make money in a system that is based upon profitability and revenues. And what is the basis for that system? They can charge whatever they want. Hospitals can charge more when the insurers raise their rates. They get a bigger piece of the pie. The pharmaceutical companies raise their drug prices, so the hospitals charge more and the insurance companies charge more. So it's a feedback loop of revenue and profitability where our dollars are funding. And not just our dollars, as in premiums and co-pays and deductibles, but our dollars in taxes. Because the truth is, our system is 60% funded by taxpayers. We just don't get our money's worth. We have every year given employers $342 billion to allow them to afford health insurance. $342 billion, plus the subsidies that individuals get to buy insurance through the Affordable Care Act. So think about this industry. They can charge whatever they want. They require subsidies and a mandate for people to buy it. They then deny 200 million claims a year. So what the hell are we buying? It's not health care. It's their profits, their revenue, their industry model, which takes money from workers to subsidize the finance economy. Who are those folks? It's clear that they're capitalists in the sense that they are investors. They're invested in the system. The insurance industry is a huge source of wealth for Wall Street. So the premiums, deductibles, co-pays that we pay are essentially funding the investment economy. And then they turn around and take a portion of those proceeds and give it to elected officials who then maintain the system. So you can see the corruption of this. You can see the corruption as the denial of caregiving and the corruption of a political system that perpetrates it. And the source is the profits, the revenue model of the healthcare industry. What they do, if Americans understood that, people in the United States understood that, I think there would be even more support. These are my top 90%. But instead, they sow confusion. They sow confusion. They use our money to basically muddy the waters. The healthcare industry, they're conducting a massive misleading campaign paid for by us. And really, one way to look at it is it's a failed business model, but a hugely successful PR machine. And they've got their handmaids, Democrats and Republicans. The Trump administration spent the last 2 weeks with Paul Ryan attacking Medicare for All. Why is that? Why is that? Because we're winning. That's right, because we're winning. They know that those working class voters and others who are denied care into the system or have economic insecurity because of the system, who fight those barriers to care, experience them and then are denied treatment and lose their life. They will revolt. And we're in a very different situation because of their attacks on healthcare and because of the impacts of this private health insurance system. But they try to make Medicare for All sound so radical, right? Oh my God, yes. If it's so radical, why does every other industrialized country in the world guarantee health care as a human right? That thing's so radical to me. If social insurance is so radical and the present U.S. multi-payer system is so great, why isn't Canadians marching in the street for Aetna? I haven't seen that. Next time someone says, oh, my aunt in Canada couldn't get her hip replacement, say, oh yeah, does she want Aetna? No, she doesn't. She doesn't want United Health or Blue Cross either. And that's the point. That is really the point, is that these countries are not perfect by any means. They're implementing austerity. They're going after labor rights or worker pay or so forth. Despite that, underlying that is a sense of social solidarity. And that solidarity was in part used to build their healthcare system. But now that they have a guaranteed healthcare system, and they've solved their cost and coverage issues by guaranteeing healthcare with no barriers to care, that has created an additional sense of solidarity. It has created a different ethos that can actually be used against those market values that would undermine a caregiving healthcare system. And so the healthcare system reinforces a different ethos in society. Now, they also claim not only that it's too radical, but it's too expensive. Okay, too expensive. We pay about 3 times what other countries pay in healthcare. Right? Ours is a fifth of GDP. Theirs is about, half of that. It's like 10% versus our nearly 20. 80%, we pay 60 to 20, and it's going up and up and up. It's going up and up and up because no one says stop.
And we don't have severe outcomes at all.
Well, we have worse. In fact, the country with the best outcomes country with the best outcomes, the best, Commonwealth Fund does these comparative studies every 2 years. The country with the highest rated healthcare system is the most socialized, the UK. The UK. That is the most socialized system. And so when they say it's too expensive, they're just wrong. I use this as an example of how we've won the policy argument. There really isn't a debate as to whether going to an improved Medicare for all is more efficient or cost effective. Now, how do we know that? Well, because the Koch brothers agree with us. Oh, you didn't know that? No. They funded a study. Remember this study, Mercata's group, right? Libertarian-oriented think tank, right? They produced a study. Oh my God, Senator Sanders' bill is going to cost us $32 trillion. Well, that sounds like a lot of money until you compare it to what they also said, which is the present system would cost $34 trillion. Oh, I think that's in a footnote. I don't think that's in the headline. So here we have the argument. The argument is not, is this more efficient? We know, for example, that this system not only costs 3 times as much, takes up double the portion of our gross domestic product, but leaves 31 million people uncovered, and another 40 million who are underinsured. People with insurance not getting the care they need. 42% of people with insurance in this country in the last year deferred some kind of treatment because of cost. Didn't fill a prescription, didn't go to the doctor, didn't get a test done. Insured people. We have literally a system where you can get all the health care you can afford, and if you can't afford it, you don't get it. And so the poor, the impact on the poor, and those others suffering from those structural barriers to care, suffer the most. All right, so they claim, oh, it's too radical, it's too expensive, and then they further sow confusion because they say, hold it, you want to expand Medicare, but that's not a single-payer system. Well, yeah, it's not a single-payer system because the insurance industry has got the hooks into Medicare and is undermining it through privatization. Traditional Medicare is very efficient. You spend about 1% on administration under traditional Medicare. That's what covers hospital bills. Well, then if you have to buy a private plan under Part B, or you go into an HMO, what's called Medicare Advantage, that's just an HMO, better benefits, restricted set of providers you can go to, or Part D, which is a wholly private drug plan. Okay, once you introduce those, the administrative costs go up, maybe up to 7%. And yet, people are still not getting the care they need for those plans. We also know that Medicare as a whole is at least half as costly administratively as private insurance. The private insurance system is at least 12% on administration for profits and marketing and executive salaries. 12% administration. So what we face really is the privatization of Medicare. And these arguments that Paul Ryan and others have made, oh my God, if we expand Medicare, we're just going to undermine it. Seniors are going to lose their care. All right, so you think about this for a second. Like, okay, let me get this straight. We put the people with the greatest needs in one program. Older 65 have higher healthcare costs, greater needs. We actually believe in this country that healthcare is a human right. It just begins at 65. So, well, that's true. Oh, absolutely, seniors deserve it. So if we mess with Medicare, the seniors are going to lose what they have. Well, that's just silly because obviously if you bring in young and healthy people, you bring everybody in, nobody out, that's going to spread the costs. It's going to be better for seniors. They won't have to go to a Medicare Advantage plan and then lose their access to the doctors they like and have a narrow set of providers they can go to. No, they're not going to have that. We'll have the same comprehensive benefits. It'll be better for seniors. I think the confusion here is that we're not clear on what the alternative is when we talk about improving Medicare for all. So the Democratic Socialists of America have handily come up with 5 principles to describe what we have in mind. A single health program. That means everyone's covered, as I said, with one plan. That's why it's called single payer. There's one payer. It's administered by the federal government. It's publicly accountable, publicly financed. And it has equal access to all medically necessary treatments. In this system, good luck getting mental health treatment, unless you're arrested. And even then, you're not really getting treatment, you're just thrown in jail and getting out of other people's way. That's not a healthcare system. that's what costs us for mental health inpatient in this country. The only way to fund that again is to include it in a system where all medically necessary services are covered. Again, a single standard of safe therapeutic care in a single program. It's comprehensive, so all of those treatments are available without restriction to provider. And the other aspect of that is the clinicians are in charge. Professional clinical judgment, not the mandates of the insurers to kick people out of hospitals quickly or to limit your access to providers. Never believe that Americans use too much health care. But I know that's a myth out there. Oh my God, we've got to restrict unnecessary care. The problem is in this country, we don't have enough necessary care. Americans go to the doctor 4 times a year on average. The Japanese go 12 times. They spend half as much. Americans have the shortest length of stay of any industrialized country in a hospital. This is not an issue of too much health care. But the biggest barrier to care, of course, are the co-pays and deductibles. And I love these plans. They say, oh, we're going to give you a cheaper plan. If you get an HMO, your co-pay is only $25. Well, that's a good deal if otherwise it's $50. But that is a huge barrier to care. So it's free at the point of service when we talk about improved Medicare for all. It has to be. Because if you have a system where you only get the health care you can afford, and therefore you're not getting it, you've got to eliminate that barrier to care to ensure you get the health care you need. That's the difference. Not health care you only that you can afford, health care you need. It's universal. Residents and non-residents are covered. That is to say, non-citizens and citizens are covered. All residents. And that's because of a very simple principle. I go back to the nurses. Viruses know no boundaries. Sorry. We know that undocumented parents are not taking their kids to the doctor who are citizens. That single garment of destiny could not be more important and must cover us all. And finally, we have a jobs issue, because there are a lot of people who work in the insurance industry. We believe that they would like to do good instead of deny care. So we would provide funds to train them into new positions in the new system. Maybe they want to go into clinical work. Maybe there's another kind of administrative job they could do. It doesn't just mean denial and profit. So we would spend some money on that, income maintenance. It's important then to take into account, again, the material conditions of workers. So we've won the policy argument. We have the potential to create a new system that can prioritize caregiving over the industry's profits and eliminate those profits and revenues funded by us. But yet we still lack the political strategy and the political movement to win it. And that's what we're calling for, is mass action. Because really, despite the decades-long effort to maintain this profit-driven industry, and they always use the word choice, competition, innovation, right? Oh, we just had more choice and competition in healthcare, things would be better. What they're talking about, number one, is choice among insurance plans. They're not talking about choice in doctors. Only improved Medicare for all can do that. And secondly, when they talk about competition, they're talking about an industry model. And an industry model, as I said earlier, where the competition just reinforces the pursuit of revenue from each sector of the industry. But under that guise, they're really referencing unregulated market rate setting and letting them charge whoever they want as prices. Honestly, you can ask the question, why does healthcare cost so much? Because prices are high. If we paid what Canada paid, we wouldn't need to raise any new taxes to cover everybody in the United States. That's how high our prices are. But naturally, in a monopolistic sector of the economy like healthcare, which is very monopolistic in terms of drugs and regional hospital markets and even insurance companies, sometimes like in Iowa they have one. They have one insurance company in the ACA. It wouldn't matter if Aetna and United Health had insurance plans in Iowa, because they would just raise their rates at the same time, because under current law they're exempted from antitrust regulations. I wonder who paid for that. All right. So this inefficiency, the coverage overlaps of the present system, it doesn't even produce universal coverage or control costs. contrast to that, our demand is very simple. We get the health care we need when we need it, with no barriers to care. And if we take that principle and say, what's your position on guaranteed health care with no barriers to care, that puts them on the defensive. Now, I don't know about you, but I've never heard a politician say, I'm going to lower your co-pays. You heard that? I've heard them say we can have cheaper insurance. Yeah, anyone can have an insurance plan for $50 a month that doesn't deliver any care. That's easy. My deductible is $10,000, I'll collect your premium, good luck. You know? That's not insurance, that's not care. Because remember, coverage is not care. Coverage is not care. Only care is care. And that's the difference between what we propose and what the present system provides. It's true that there is a group in this country that does have that, no barriers to care. As socialists, we call it the ruling class. We call it the capitalist class. These are the investors who are benefiting from the system. Literally, the wealthiest people in this country pay a fraction of their income for health care. 0.4% of their income on health care. And when you look at these fancy hospitals and these private rooms and their high-tech, high capital investments in MRI technologies or other imaging technologies and the latest specialty drugs, you realize, oh, this is a very successful system for the global elite who come to these U.S. hospitals for treatment. It is literally enshrined inequality in the healthcare system based upon an investor model that lets, especially the pharmaceutical companies, they are hugely profitable. United Health is chump change compared to what the pharmaceuticals make. Literally tens of billions of dollars a year in the pharmaceutical industry. They raise the price of insulin 500%, people die as a result. That has happened. So our demand for guaranteed health care generates unity precisely because it's class-based, because it says workers must have that same access to health care, that it must be no barriers to care. And it generates this unity because it directly addresses the real human condition of working people in all of our complexities, addressing all those structural barriers I referred to. And also, it's something unique about the healthcare policy is it's the area where public policy most intimately affects our lives. And so it's an entree. We understand the structural inequalities of the system. We understand how we're connected together through kindness, through the garment of destiny, as Dr. King said. And then we understand why public policy in this area matters so much to us. So really the issue is how do we go about winning this game? And as usual, and it's appropriate, here we are at university, we have much to learn from our teachers. Because what happened in these red states in West Virginia and Arizona and Oklahoma this year? It brought us the most exciting wave of labor insurgency we've seen in decades. Tens of thousands of teachers joined in mass strikes in those states. What did it start with? It started with health care. But what did it lead to? Tax the wealthy, reduce class size, child care. And so you see these streams of demands for justice coming together. And the teachers are running a very sophisticated communication and PR strategy. Let that be a model for us. Taking on the healthcare system is going to take a confrontation directly with government and with the boss. Think of companies like U.S. Steel. U.S. Steel is benefiting hugely from the present administration's tariff. What are they doing? Demanding healthcare concessions from steel workers. What have the health insurance companies done with all those tax cuts? Stock buybacks, rich shareholders. What's at the heart of the hotel workers' strikes that we've seen in the last few weeks? Healthcare. Some of those hotels, some hotels, unionized hotels, pay more per hour for healthcare than they do in wages. And if the wages don't go up, they're just going to lose their health care because they literally can't afford it. So it's a vicious circle. And what we learned from all of this is that the elites are actually worried we're going to abolish this present system. That's what they're actually worried about. That we might abolish the private health insurance industry. I saw a video from Paul Ryan talking about that today. What I'm trying to figure out is what the problem is. Now, go ahead and keep saying it, Paul Ryan. I'll tell you, the people I talk to, they want one thing that the private insurers can never deliver when it comes to health care. Peace of mind. Peace of mind. Health security. Guaranteed health care with no barriers to care. There is no way that the system can provide that. And these guys are prepared to throw their weight around behind this murderous industry to maintain their profits. We have to combat this assault with a mass movement of working people. But let's start now in 2018. This governor's race, for example, in Florida, is crucial. We know, number one, that people will die if Andrew Gillum is not elected, because the Medicaid expansion and the other issues that need to be addressed will not be addressed by DeSantis. We also know that Andrew Gillum won the primary in part because he demanded Medicare for all. And so our task is to hold him to that primary position. That's our purpose. That's our purpose. I don't care what the consultants are saying, making them say, or what they're saying, or whatever. I know that we can rise up and hold them accountable for that program. Secondly, let's have a fight in 2019 over H.R. 676 in the House when the Democrats take it. Now that's a big deal because we know that Nancy Pelosi, Chuck Schumer don't want that. They too are worried about the elimination of private health insurance companies. I keep hearing how Democrats like those Medicare Advantage plans. So I ask you, what political party in the world would not demand a program that 85% of its supporters want? That would be the Democrat Party. You got to change that. We also have to elect a Congress and a president in 2020 that will fight for this. We know we need that kind of leadership. We've been here before. We were here in the 40s when workers were bought off and got into the private health insurance system, and then the right wing defeated the Wagner Dingell bill for Medicare for all. We were here in the 70s when the Democrats had the president and the Congress. We were here in 1993 when the AFL-CIO endorsed Hillary Care instead of single payer Medicare for all. And we all know where we were in 2009 when we had a president, a brilliant guy who knew Medicare for all was the answer, but we didn't have the leadership or the movement to demand it. That's our fault. And we have to recognize, given those historic failures, a sense of urgency about how fleeting this moment can be if we do not demand what we need. And that's the difference. You cannot settle up front and compromise up front because you know we will never get there. And history has shown that. We must demand what we need and want. And that demand has to be improved Medicare for all. So this mass movement of working class people can succeed. Because as Dr. King reminds us, of all forms of inequality, injustice in healthcare is the most inhumane and shocking. And I think inhumane resonates because our struggle for health justice ultimately can reclaim our humanity. It really is back to the nurses that we can reclaim the human kindness they practice at the bedside, which is really at the heart of solidarity. So as we reject the corruption of the present moment, and it is fundamentally corrupt, let's share our alternative vision for an equitable society, which is represented by Medicare for All, where working people make the decisions that determine our destiny. Then we can truly change these things. And the political economic structure that got us here and inhibits our future freedom. For without health, how can we be free? And that's why we say, all in. Thank you very much. All right, now you're in for a treat. Jose La Luz.
Let me start by acknowledging the presence of two friends and comrades, as I like to refer to my compañeros and compañeras in the struggle. Thomas Kennedy, the political director of the Florida Immigration Coalition. And Maruxa Cárdenas from Our Revolution, Puerto Rico. Maruxa was part of the Bernie Sanders team that put the brakes on Hillary Clinton's drive to secure the nomination in the primary in Puerto Rico. The shoestring budget, they built the campaign from the bottom up, which is in fact the only way to build mass movements, is to actually build from the power of the people, from the bottom up. There is no other way. Because this movement is all about building a multiracial, all-inclusive movement of men and women of different sexual orientations, of different national origins, and yes, of different accents like mine. Let me suggest to you, my friends, that we have won the policy debate, because the overwhelming majority of Americans know for a fact that ours is a broken system. And so what we need to do is to make sure that this does not continue to be a movement of the enlightened few, but that it becomes a movement of the tormented many, of the ones that are suffering, of the people who have to make choices every single day in terms of whether they stop paying vital necessities or they are able to pay for the necessary health care for themselves or their loved ones. And I dare suggest, in the wealthiest country on the face of the earth, that is a travesty, that is not acceptable, that is immoral, and the moment has come to change it, and change it for good, and change it forever. But this change is not going to happen by cutting a deal. This is not about cutting a deal, which is what these people that occasionally we will become enthusiastic about and choose to actually go knock on doors and make phone calls for. You and I have seen that behavior that Michael was illustrating. We have seen the temptation that they fall over and over again, because they only have learned that it's all about cutting a deal. And this is not about transactions, this is about transformation, I dare say. So, the question for me is, how do we mobilize the will of the majority? And if in fact 70% of the American people favor this thing that Michael and I call Medicare for all, but in the part of the world that I come from is known as Salud para Todos. And I see some faces that gives me the impression that some of you hablan español, ¿verdad? Yeah. So you know what I'm talking about. This notion of universal health care is in fact the reality in the overwhelming majority of nations around the world, not only the industrialized nations. How is it that people in Mexico, people in Argentina, people in Spain, even some nations in Africa, even many nations in Asia, can have access to healthcare when they need it? And why is it that in the wealthiest nation on the face of the earth, tens of thousands of people actually die because they are uninsured. So I dare suggest that ours is a movement to save lives. Ours is a movement to save lives. Ours is a movement to save lives. And it's important to understand the meaning of that. Because when you understand that this is a movement, in fact, to save lives, this is not a debate about whether or not the wealthiest nation can pay or not. If Spain can pay for it, if Mexico can pay for it, if Canada can pay for it, if Argentina can pay for it, the wealthiest nation on the face of the earth ought to be able to pay for it. And so, I don't envision us going to beg to these people that we're going to help to elect in Congress. No, sir. No, man. Absolutely not. We are going to demand it in the streets, because it's in the streets when we have to mobilize the energy of the tormented many. And the voices that have to emerge are not Michael's and mine, are the voices of the people who are making the choices every single day. The ones that have suffered the pain. The ones that have seen their children die because they have not had enough to pay for the necessary health care. Those are the voices that have to emerge. Sisters and brothers, are you with me?
Yes.
So we are not going to beg Chuck Schumer and Nancy Pelosi. Fuck that! We are going to be standing right next to Alexandria Cortez-Ocasio when she says, I have had enough of your goddamn bullshit. We have got to move forward. We have got to have Medicare for all in the wealthiest country on the face of the earth. And that is what is going to make it happen. Because, let me suggest, sisters and brothers, this is not only a battle of ideas. This is, in fact, an affair of the heart. This movement has got to be about the heart. Because when people feel it in the heart, they do this. They start marching. They get themselves in motion. They become indignant. They become enraged. And when rage and indignation is mobilized, what happens? People listen. People pay attention. The same way we built an anti-war movement in this country, and we were able to put an end to the war in Vietnam. That's the only way. How do I remember? Because I came to this country in those very years. And I saw it. I lived it. I saw the tens of thousands that mobilized turn into hundreds of thousands. And then millions of people in action demanding an end to the war. And so this is the only way that change actually happens. We have got to mobilize the rightful indignation of people. And let me ask you, is this moral, what we have in this country? Is this moral? Absolutely not. This is totally immoral. So this is not, we have the high ground in this debate. We have the high ground in this debate. You know, we are not the radicals that some people would like us to portray us as, right? I mean, we are the reasonable people. Right, don't you think? We are the reasonable people. We are the people who are driven by our values, right? And one of the most fundamental and basic values is I cannot let my sister die right next to me. I cannot let my mother die right next to me. I cannot let my friend and my neighbor die right next to me. I have got to stand up, and I have got to yell, and I have got to scream, and I have got to do whatever I need to do to make sure that everyone does have access to the necessary health care. Don't you think? There is not much more that needs to be said. But you're going to be seeing a lot of us, because we're not going to go with kind words to speak to those assholes in Congress. Oh, no way. No way. No, 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 no. I mean, rightful indignation is rightful indignation. And let me say this. This fellow, whose name I can't even pronounce, who inhabits this thing called the Waco House, right? The Waco in chief. You know who I'm talking about. This fellow ran as a so-called populist, right? As a so-called populist. Well, there may have been an element of that, because in fact, what we have witnessed in this country is the rise of right-wing populism. A very dangerous threat of populism that can pave the way for very horrible things. And we have already witnessed very horrible things, because let me ask you something. How can we stand it that in the most democratic country on the face of the earth, children are in cages, separated from their parents? It reminds us of the horrors of the Japanese internment camps. How can we stand something like that? Is that moral?
No.
Is that acceptable?
No.
Absolutely no. Absolutely no. And now we are witnessing episodes of violence against people like us, who are driven by kindness, who are driven by the desire to build a better world. And we not only want to contemplate, we want to do something about it, which is the only reason why you're here. Because who else in his or her right mind would be here at 8 p.m. on a Monday evening? My goodness, I'm actually surprised myself that we have an audience. Michael, we have an audience, thank God! You know what that tells me? That there is will. Because the men and women, the people who choose to take action, like yourselves, are the ones that turn the wheels of history. And there are a lot of people out there who have no, I was going to say something, excuse my French.
So late for that.
No, they have no idea what we're doing here. They're probably walking around and, you know, those lunatics in that room, you know, some of them with these red t-shirts, are going to hear a couple of other lunatics, right, talk about this thing called Medicare for all. And yet, they don't know that by being here, we are actually making a powerful statement. Because we are saying we want to be part of that movement. We want to help build it. How many of you want to help us build it? Right? Absolutely. Absolutely. We want to build it. It's going to look entirely different than this room. It's got to have a lot more color. Okay? Among other things. Right? And it's got to have a lot of other ingredients. It's got to be this powerful soup like the ones that my grandma used to make. Right? You know, with this wonderful aroma that comes out. And you say, oh my God, I want to have some of that soup. Right? You know what I mean? And this is what we are up against. Michael is absolutely right. The question of the policy debate has been won. We have won this debate. That's why they are in fear, putting all of those ads and portraying us as irresponsible lunatics. The battle that we haven't won is the political battle. To make sure that the 70% count. And I have to make a confession to you today. I was not until recently, and Michael knows this because we've known each other forever, an activist, an advocate of Salud para Todos, or Medicare for all. I was a social justice advocate in many other struggles, immigrant rights, the rights of men and women of color, right? The rights of the people in my homeland to free themselves from this thing called colonialism, right? So I have a little story and then I'll end up with that. Something happened to me. I had an epiphany. I went to my homeland in this little island in the Caribbean, not far from us. It's not Cuba, Puerto Rico. I went there because this incredible hero of mine, the mayor of San Juan, Carmen Yulín Cruz, right? Whose face you saw taking on Trump. How many of you saw her face taking on Trump, right? And she is one of my heroes. So she called a few of us and she said, I'm going to need your help because there will be a delegation of 350 men and women from more than 20 unions in the US that are going to come down and help us. And this was several days after the second catastrophe that hit the island. The so-called natural catastrophe, because some of you know that there was a previous catastrophe that hit the island. I don't know how many of you know.
Professor.
Right?
Yes.
This man-made catastrophe which resulted in the people of Puerto Rico owing $140 billion to Wall Street banks and hedge funds. Right? How many of you knew that? So the island was already on its knees because the government had declared bankruptcy, right, before the so-called natural catastrophe hit. So the mayor called a few of us and she said, I will need your help. Because, I got to put these people up someplace in the Coliseum, and God knows, what they're going to demand from me and whatnot. I need my help from my friends. So I ended up going to the island. And I had the privilege, I think this is destiny, of meeting the 50 nurses that were part of the contingent. And let me tell you how they changed my life. One night, past midnight, we got a phone call. And it turned out to be one of the nurses. And she said, I'm sorry, we're calling this late, but we've got some very serious issues that we need to discuss with you. I said, oh my God, it's past midnight, everybody was exhausted, right? I mean, you could picture a few days after the hurricane. So we said, my colleagues said, of course, let's ask them to come over. So they came over, a small group came over, and they looked very serious. And we said, oh my God, what's going on here? So finally, we sit around, and one of them said, with all due respect, brothers and sisters, to the little group of us that was there, coordinating the logistics of this thing. And she said, we have some issues that we have to take up with you. And we said, sure, of course, I mean, we're all leaders, And she said, well, I am sorry, we are sorry to report that we are not achieving the mission that we came here to do. I looked at my colleagues, they looked at me and were saying, oh my God, this is getting serious, okay? I mean, this could become an international scandal, if you know what I mean, right? So one of us asked them, what do you mean you're not, achieving your mission? And another nurse said, with all due respect, sir, what's your name? And I said, Jose. And she said, well, Mr. Jose, we are here and we are not where we need to be. So I said, oh, okay. This seems to be a matter for the mayor to decide, right? So somebody put in a call to the mayor. This, by now, it's about 12:35 in the morning. And the mayor gets a call. And she said, God damn it, you know, this better be important because I'm so goddamn tired, you know, I mean, I've been going all day. This is the mayor. I mean, she's the mayor, but she talks like that, right? I mean, otherwise, I mean, so somebody said, no, mayor, I mean, this is quite important. I think she said, I am going to dispatch my medical director. And so the medical director, it seemed like he flew from wherever he was. You know, he got an airplane, one of those charter planes, because he ended up there in 2 or 3 minutes. He was in the room, if you can picture it, right? And there he was, the medical director. And so one of the nurses stands up and says, I am sorry, but you all have to know this. Many of us have been in missions in Africa, in Haiti, and many other parts of the world. And we are not doing what we came here to do. So the medical director says, okay, I thought you were, you know, giving people care. And she said, I'm sorry. We came here to save lives. All of a sudden it dawned on me that what this movement is really about, it's about saving lives. And so the only thing that happened at that moment was that some of us started to cry, and we embraced the nurses, and we said, what do you need? And they said, we need to get to those towns in the mountains where people are dying. That's what we mean by saving lives. My whole life changed forever. That was my epiphany, exact one. That's when I learned the meaning of saving lives. And so I dare suggest, sisters and brothers, that ours is in fact a movement to save lives. I am going to ask you to stand up with me for a moment, because we are going to try to end this on a very, 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 very high note. And we want some questions after this, if you have some energy left, by the way, okay? But this is something I learned from this fellow called Cesar Chavez, to some of you, Cesar Chavez, right? And in order to give us strength, he would ask us to put our hands together like this. Sí, sir! Sí, sir! Sí, sir! Sí, sir! Yes, we can! 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 Sí, sir! Sí, sir! Sí, sir! Slow down! Slow down! Other energy, you know?
So I noticed when we were talking, there might have been some questions that folks wanted to raise, so I just wanted to give us a chance to do that. Yeah.
Yeah, well, so I guess my big question is, you said something that I hear people say sometimes that I'm not sure that I really agree with, at least as a sort of strategic talking point. A lot of people talk about how this is not a partisan issue. You know, Democrats and Republicans support it, but that's clearly like not. There's no sort of operational value to that. Like, I mean, So first of all, as far as the DSA definition of Medicare for all, the fact that it needs to cover undocumented people, I mean, I don't know that that's in the surveys that you're talking about, that that's being presented. And I imagine that would, first of all, among rank and file Republicans, that would certainly drive support way down. But secondly, we're like, when we talk about passing Medicare for all, we're talking about getting it through the House and Senate. So we're talking about Democratic and Republican politicians. And so at that point, like, we clearly are talking about a partisan issue. And so, and like, if the idea behind this sort of, nonpartisan thing is, the idea that we need to talk to everyone about it, I mean, the sort of, what follows from that is, like, we have to get Republicans to vote for Democrats who support Medicare for all. Like, because there aren't going to be any Republican politicians that support
I actually agree with you.
Well, yeah,
I think I have an idea that would help facilitate it. And whenever you're finished responding, I'd love to add something, because I love this idea. I really do.
Because see, here's the thing. We're not asking these Republicans to vote for Democrats. What we're asking is, what we've got to do is we've got to build mass organization. We've got to build organization capacity on a class basis. Because what I was arguing is that there is a real unity among workers on this question, regardless of whether they're Democrats, Republicans, or Independents. That's really what I'm arguing. And so when I've been, I talked to folks in Texas. They're very conservative relatives who support Medicare for all. They're in DSA.
But they're going to vote for Ted Cruz and not Beto O'Rourke.
But Bean, that is different from them demanding that Ted Cruz do this.
He's not going to do it.
But here's the thing. You're so goddamn certain of everything. Why would you organize anything?
I would like to organize something that's reasonable.
The point is not a talking point. The point is, this is an issue that can generate class unity. The working class unity precisely because it directly addresses people's fundamental need for guaranteed health care. And that if we build mass organization, like in California, for example, the issue of covering non-citizens is not a barrier to winning single payer in California. Okay?
I'm not saying that's a barrier to winning. I'm saying.
All right, get space to somebody else.
All right. Yeah, this is it. All right. I'm listening.
And so, what I would suggest is this. Politicians sometimes do things that they don't want to do. If the demand is strong enough. They didn't necessarily, you could argue there are a number of cases where Republicans have voted for things that are not consistent with the Republican Party platform. There are a number, and the Democrats are as big a barrier here, I would argue, as the Republicans, because they're both invested in a system, a political system that's dependent upon the donors that profit from the healthcare industry. So that's where the crux of it is. You can look at any surveys and public opinion surveys. The corruption of this political system rooted in money is a nonpartisan issue, just as healthcare is a nonpartisan issue. The fact is that the Trump administration attack on the ACA has changed the popular perception of Medicaid. Medicaid, which was a program that the right hated, now really is in a much stronger political position than it's ever been since it was instituted. So these things change. That's all I'm saying. Don't be so certain. Don't be so certain. Remember, the Democrats were the party of the white South. The Republicans were the party that ended slavery. Things change. Boom. Yeah.
I was going to say, like, I know that we've already won the ideological debate, and I agree. And so my next question is, now that we have to enter the political arena and succeed there, a lot of the narrative pushed on this movement is that it's radical, that it's not attainable, it's unrealistic. So in a political sphere, how do you, like, I mean, not you specifically, like, I know it's not going to be you up there, like, defending us, but, like, how would anybody go about defending themselves against, like, somebody trying to destroy their character, especially if there's somebody in place right now who is big on, like, trash talking other politicians, like how do we deal with that and like make them take us seriously?
Right, and I was really arguing we still have an ideological fight to win. We don't have a policy fight necessarily, right? And so it basically comes down to government and taxes. If we really want to get down to it, people say, well, we can't afford it because we have to spend it through government, right? So we got to take that on. And
can we do that just by electing the right people?
we can't do it just by electing the right people. What I was arguing is we've got to elect the right people. We've got to build mass organization, and we've got to have galvanizing leadership at all levels. And we've got to have a direct confrontation with the boss on a class basis. This has to be a working class demand. I think that's what Jose is talking about, is building a multiracial movement of workers, right, that is able to go beyond. That's really what we're talking about being as nonpartisan. We want to organize by working class Republicans. We do. We do. We have to. If you look, so yeah.
If I may, I think I know what to do. So, Maria.
What's it? Can you speak up?
Yeah, I think I know what we should do. Because, look, if what we all believe is that we need Medicaid for all, it is almost impossible to get any Republican to coincide with that belief, or coincide with that narrative, unless we have funding. Because what would happen if we just said, we literally said, let us allow us to do it. Our debt would drastically increase. And you guys know what happens when our debt drastically increases? No, because there's actually a solution if you're interested. Because I believe in this too. I believe in this too. So, if our debt drastically increases, our country will lose power in the world.
The debt is a right-wing issue.
Yeah. No,
it's actually a way to undermine the government's ability to meet human needs. So
because this is why they don't want to do it, because they want to decrease our financial debt.
We're going to move on. Thanks.
Listen, so if
seriously, we got to move on. We got to talk about that.
You got your point, and
no, I still haven't made my point.
Yeah,
you guys don't believe in this?
You guys don't believe in this question. Thank you so much for your contribution. Other people have
because we have fiat money, dude. If we print our own money. We issue debt in our own currency.
We had a question right here.
I really want to say something. So I almost lost my mom because of a lack of health care. My mom has insurance. It's the worst part. My mom has insurance. And her deductible is $6,000. She doesn't have any way. She wouldn't never be able to pay this amount of money at all. Thankfully, when she was about to die, she went to the hospital, and now she has $6,000 debt, probably more, because she technically probably a bunch of the health care that she was received probably was denied. I understand this to a point very, very, like, even I right now, I don't know what's going to happen to a point. I get sick, and we don't know what to do. And that's a situation that, this is what we're living in here right now. A lot of Americans right now, 40,000 people a year die due to the lack of health care. We don't have primary care. Primary care reduces the cost of health care because we check when we feel sick, we check ourselves. Instead of checking ourselves when we have a terminal cancer and we die, like happened to an uncle of mine. I've experienced this, and I just wanted to put this out because I feel like this is a very, very important issue, and I think things like primary care are going to reduce even further the cost of our health care.
That's right. Those stories are really at the heart of this. Those stories really are. We have to collect those stories. We have to lift them up, and that is part of the building of this mass movement and the organizations.
And I was just going to
finish your point.
Oh no, I was just going to say, when it comes to that, this is a very well-structured plan, by the way. I don't know if that's probably there, thankfully. This is a very well-structured plan. It has like a whole tax structure and everything. It's not like it's a made-up plan that we're just going to. It's ridiculous, the notion of it.
And remember, they never asked how we're going to pay for the Iraq.
Exactly.
Peter?
I have a question at the point. One thing you have to remember is that if they had it their way, Democrats and Republicans, they privatized the whole country. They make you pay for the air you breathe. If anybody anybody wants to know why they poison the water in Flint, Michigan, it's because they want to basically gentrify the entire city. And the only way you can do that is by kicking out low-income people. How do you do that? Poison them. That's one way. So that's my point on that. And it all comes together with health. And my point is this. Michael happens to be a friend of mine, and I did pitch an idea to him that I think could actually work. Now, how many of you think that if we were able to convert potentially millions of supporters for Medicare for All, that it would be worth maybe a $3 million investment? Who would agree with that amount of money? It would be worth millions of supporters. Has anybody thought about the prospect of investing the $3 to $3.5 million it would take to put a 15 to 30-second advertisement up during the Super Bowl? That basically says a simple message, nothing over the top, no politicizing, just no copays, no deductibles, no middleman, just healthcare. And then you can put a website right below, something along the lines of MedicareForAllNow.org, and you'll crash the site that night. That's what will happen. But what I'm thinking is, think about how many red-blooded Americans, especially in the heartland of the South in particular, that may not be as well versed as they should be in these types of topics. That if they saw it on a Super Bowl, they're going to go take a look at it. And they're not going to necessarily listen to what, Nancy Pelosi and Chuck Grassley and Lindsey Graham have to say about the issue. Because what they're going to hear is all horseshit. Just as I tell everybody. If you get your news from MSNBC, CNN, and Fox News, you will learn nothing. It's when you actually open your mind to change, that's when things happen. So if you think it's a good idea, I think we could potentially talk with greater light about how.
I like the idea. I mean, because I really think it's a galvanizing issue. And there are, I think there are literally tens of millions of people who are responsible. Yeah.
Okay, so I actually have a question. So some of your points you made about the polling for Medicare for All. So I'm like all for it, and I'm like, I wish we'd get that again because I also have personal experience with a close family member that have to travel outside the country to get here and stuff. But kind of like a cautionary tale for me is kind of like the Affordable Care Act. Like I feel like the way you frame and the words you use are so important for the way people respond to policies, even if like the policy itself is the same. So it's kind of how you get people in like Kentucky saying that they like the Affordable Care Act and not Obamacare. So how do we get Medicare for All to not become socialized medicine, and then having the support of 40% of the population rather than 70%?
Well, the Medicare is extremely popular, and it works. So we tried everything else, let's try that. Right? And that's why I kept saying guaranteed health care. Guaranteed, universal, people can talk about universal health care, they can talk about universal coverage. Everybody can have insurance, and 42% of the people still don't get care. So guaranteed health care really puts them on the spot. How are you going to guarantee health care? The seniors have guaranteed health care. Why doesn't everybody? Why is it that you turn 65, you have it, or you're under 18 and you have it, but the rest of us are kind of just at the mercy of these insurers who deny us care? So guaranteed health care with no barriers to care is, I think, the better message. And Medicare, improved Medicare for All is the best message to kind of encapsulate it in conventional terms because it speaks to the program that's popular and works and tells seniors it's going to be better. So that's the messaging. We did the polling. Guaranteed health care does poll better than universal health care, certainly better than single payer. Medicare for All definitely polls better than single payer. You can do all this, and they have. But the bottom line is on the narrative question, we do have to win the narrative, obviously. And the social media work and the communications work is essential, but so are elections. In this country, elections define the narrative. If Andrew Gillum wins, Medicare for All is an easy thing to say, that's part of the reason why, right? If Beto O'Rourke pulls it out in Texas, which is, maybe unlikely, that would be very significant. Again, these things, I mean, Ted Cruz losing to a candidate who supports Medicare for All, he said he would vote for Bernie's bill. So these matter in the narrative, right? Again, we got to move the labor movement. We do need that institutional support. But frankly, they represent 7% of the workforce. So 93% of the workers that aren't unions. So we got to win those most. So that's really what I'm trying to argue is that ultimately the movement itself is able to generate a narrative that becomes compelling. And everybody's story, everybody has a story. It's either them or their family. Everyone suffers from this healthcare system. If we can win this healthcare debate, it is the entree to changing people's, again, what I would call the ethos and also the political economic structure, the role of government, sense of social solidarity. Those things can't happen. Medicare desegregated American hospitals when it was implemented in '66. That's not a coincidence that it rose up during the time of the Civil Rights Movement, and that is the time we're in, between Black Lives Matter and Me Too and Occupy. This is a rising tide of justice, and that itself builds a narrative of demand. People in this country don't necessarily believe they deserve it. When you talk about Medicare for All, they say it's too good to be true. And those lower expectations are being challenged by these justice demands and these movements. When the teachers go out on strike and when these other workers are in the streets, this is changing the narrative and, most importantly, the sense of possibility. So if we can win Medicare for All and fight for it, it actually promotes people's belief and compels them to demand more of society as a whole. And that's what's at stake. And then we do overcome these partisan divisions. Do not think that things are static, that this definition of what's partisan is, forever. It's not. That's human action changes it. It changes what's possible. And these victories that we achieve, when you win paid sick leave, when you expand Medicaid on the ballot in states like Maine or Idaho, like might happen this year, that changes when these red state teachers go on strike. That changes people's perception and what they demand. And if we demand what we need, then we can win it. That's the point. Yes. Is that Lily?
Yeah.
Yeah.
So I guess just one kind of basic question that I had, I mean, it's a complicated question. A simple one to ask is the transition to envisioning this system. And I think, like, as Jose burned into our minds, this is a movement to save lives. And right now, every single day, people are dying with the system that we have, dying unnecessary, premature, unjust deaths. And not only in a political sense, but also in a practical sense, transitioning out insurance companies and the massive administrative bureaucratic system behind that will be a process. And so I guess I'm just wondering your thoughts on our transition to that system. And I guess more specifically, like, until we win a national Medicare for All system, what do you think of statewide efforts to win Medicare for All?
I think it would be hugely beneficial to win state single payer in California, which is the most likely state. Remember, Democratic legislatures in the states will, if it's a blue state, will pass single payer as long as there's a Republican government to veto. So what it takes at the state level is gubernatorial leadership, and probably we'll have that in California if Newsom wins next month. And the Democrats may have a supermajority. So that makes a huge amount of difference. I don't think state single payer is pure policy, single payer, but politically it's hugely significant. So in Florida, we had the Healthy Florida Act, and we had the Healthy Texas Act. Not that they're going to pass in the legislature, but they're going to be introduced next session. But then you can go to these red districts and you can start organizing and saying, yeah, demand this of your legislator. That is building the momentum. So I think there's a huge political value to organizing at the state level on this issue. Because it gives people an immediate thing. Let's go knock doors. Let's talk to our neighbors. Let's get these stories out. If people believe that it's happened to them or their family or it could, that's when their mind's open on the issue. So I envision that California as a model would, and we elect the leadership through this movement that we built, we then can use that as the basis to win it federally. So I do believe that. So what was the other part of the question, though, was how do we envision this actually, politically happening? Well, what we know, I think it's pretty obvious that if President Obama said, I don't want the Affordable Care Act, I don't want to enshrine, the private insurance company, I want to expand Medicare, and here's why. This is the most frustrating thing, Jose made, okay, is that we all can't do this, we're Democrats, we can't do this, we got to moderate our position. Well, that white supremacist in chief hasn't moderated anything, and look what the hell he's doing to the country. And you tell me a left president couldn't do what we need? I don't buy it. I don't buy it. And this guy is governing with 40% of the support. We've got 70. And we say it's impossible politically, we can't move people. I just don't buy it. There's got to be this, it's got to be that galvanizing leadership at all levels. Yes, President, Congress, but most importantly in our organizations, our unions, our student organizations, and building organizations, DSA, so you have the capacity. I just don't buy this low expectation notion that the Democrats are the only ones who seem to have. Do you want to get your ones?
I'm just thinking that, that's why, everywhere I have been, I frankly speak about a movement to save lives. Because once you start getting into these debates that I refer to about the debates of the enlightened few, you lose. The debates of the enlightened few are the debates that some of us used to have, remember? I mean, is it Comrade Mao Zedong who says that power comes out of the barrel of the gun, right? Or is it Che Guevara that said everybody, needs to, revolutionaries motivated by great feelings of love? And so a whole generation of young men and women in Latin America went to the mountains and the streets, and they paid with their lives, and they're no longer here. Is it about Trotsky, right? Permanent revolution, right? And so I think that we're fortunate that this fellow called Bernie Sanders, and I love that instead of Bernard Sanders, he's Uncle Bernie, right? he's Bernie. You know what I'm saying? He's Bernie. I remember Maruxa when he went to Puerto Rico to campaign, right? Because in Puerto Rico there's been a vigorous, mass, left movement for quite some time that's been calling for an end to colonialism, right? The mayor of San Juan said, if something illustrated clearly that we are second-class citizens, what better image than this fellow whose name I can't even pronounce, throwing the paper napkins. You remember that time that he went there, throwing the paper napkins? They happen to be Scott towels, by the way. I don't know if you remember. So I was wondering if we could make an association of Scott towels and the Scott that's running here, right? And the humiliation. And the reason I'm saying that is that 77,000 new Puerto Rican voters have been registered in the state. Okay? That's going to make a difference election day. And so these are the things that change. But going back to Bernie, when Bernie went to the university, right? Maruxa?
Yeah.
People are saying, oh my God, first of all, he speaks English. We have never heard Bernie say buenas noches or buenos dias or anything like that. Did he actually say a word in Spanish?
Yeah, he did.
Huh?
He did.
He did? What did he say?
He said something like, good afternoon, good morning, whatever, and then he also said, we need marijuana for all or Medicare for all. He said it all.
He actually, put together a few words,
Yeah.
which is interesting, and the next thing he captures the hearts of the people, right? And the place was packed. They even had to have a whole bunch of people outside. And everybody in the island is saying, who is this man from Vermont? Who is, how old was Bernie when he was running? 74, right? I mean, he became like everybody's favorite abuelo, right? Grandfather. But he lit the place on fire, so much so that a campaign was built out of nothing on a shoestring, and they actually put a stop to Hillary Clinton's drive. She was going to win the nomination in Puerto Rico. They were getting ready, the press conference and the whole thing. And all of a sudden, this movement of young men and women, mostly people like us, Well, I include myself because age is just a number, as people say, right? But, everybody was stunned. And so I saw it. I felt it. And the way he framed this is that we have got to put an end to injustice. Something very simple. A simple idea. A simple idea. So I have very low tolerance for the very deep, ideological discussions. Where the next thing you know is, oh, I got to quote, that one and the theory and, No. I think this is about values, to be perfectly honest with you. It's about some simple values, and there is nothing more powerful than I will not allow my mom, my nephew, my daughter, my dad, my neighbor, my friend to die in a country that has so much wealth. This is a powerful, compelling message, don't you think? It is. It's immensely powerful. I'm thinking about your proposition. I mean, if the face of somebody that has had to make a choice of the kind that we've been discussing here presents herself or himself in the Super Bowl, telling that powerful story of, the choices that he or she had, I think people are just going to say, wait a second, we've had enough. We have had enough. This is absolutely immoral, unjustifiable. And so I think things happen when people's hearts are touched. I have seen it. It's not strictly an affair of the mind. Let me very respectfully suggest that to you, sisters and brothers. And I have been in this social movement for quite some time. It's not a matter of ideological and politically deep, no. It's a matter of simple, fundamental human values. I dare suggest, with all due respect. Okay?
All right. Yes?
Yeah, good evening. I have a question in regards to what you mentioned before about the structure, levels of government, society, just socioeconomic classes among people. We see that there's corruption and greed within the privatization of healthcare in the United States. But what would you suggest in regards to the prevention of corruption within our own government? Taking if populace's money, we trust our government to spend it well.
Excuse me, Michael, can we let this be the last question? I'm
Yes.
thinking
Yeah.
because, I got to drive back to some place.
No, definitely.
It's not
So
near
what-
here,
So yeah, just to recap on that, we see again the corruption and greed in the privatization of healthcare, but what would prevent within your structure, what would prevent the corruption and greed within our government appropriating funds from the populace to do whatever they wish to do?
Well, see, ultimately, government is democratically accountable the way that private industry is not. Angus Deaton, who's a Nobel Prize-winning economist, right? He says that healthcare is a driver of inequality, that it is actually the worst example of crony capitalism. That's what we have in healthcare. The corruption of government is the corruption of private industry, private individuals using government for their means. And so Deaton is not a radical economist. He's not a left-wing economist. He's a mainstream economist who says we have got to do Medicare for all in order to end the corruption that is endemic in healthcare. So it is it's a mind twist. It's a mind twist. Government is more efficient. Government actually is accountable. Government is the solution, and we will pay less for healthcare if we fund it through taxes. It challenges these fundamental assumptions, and those who have really looked at it, the evidence is overwhelming. We've got to wage the political fight then to win, and that's our challenge. That's what I would argue. Right. All right. So let's look at that.